do it correctly. Perfect. Okay, Dr. Schrader. So the purpose of this interview is to describe the nurse leaders and scientists and how they perceive their contribution to healthcare outcomes and policy. So thank you very much for your time, and thank you for sharing your experience with both UH and our community, as well as the graduate nursing students across the country. And could you just start us off by introducing yourself with your full title?
Hi, sure. So I am Patty Schrader. I am a clinical associate professor, and currently I'm serving in the role of the associate dean as well at the University of Houston, Andy and Barbara Gessner College of Nursing in Houston, Texas.
And what was your career trajectory that has taken you to this position?
Actually, I was very blessed with my career. I started off as a critical care nurse and I did critical care nursing for many years. And then whenever I left the bedside, it was really as a critical care educator. And then they asked me to be the associate director of nursing. And so I was, for a while, I had a combination job where I was a critical care educator and I had the opportunity to work with the nurses working in the ICU environments, telemetry, and then the ER, and educating new nurses. So that was kind of before residency programs came out in mass. And so we were one of the hospitals that started one where we were orienting new graduate nurses to those high acuity areas. And while I was serving in that role, they asked me if I'd also be the associate director of nursing. So I did that again for several years. And then they asked me if I would be the director of what they called quality related services. And that was a really unique position. And I really, at that time, struggled with how do I divide my time away from nursing and do other fields. But as the director of quality related services, I was over medical staff, utilization review, infection control, um, case management, um, and so in that, I had an opportunity to impact patient care at a different level. So it was really a great opportunity for me to have exposure to interdisciplinary, interprofessional activity and go beyond nursing. And so I had an opportunity while I was in that role. I had a great vice president of nursing, and one of my friends called me because they had a faculty shortage due to a death of a faculty member that was unexpected. And so they didn't have anyone to teach critical care. So they asked me, will you come teach critical care for us for this semester? And my VP said, sure, we want to do anything we can to help out future nurses, right? And so I went over there and I found out that was my true love, was teaching. And so I left a high paying job in the hospital to go and teach, but I've never looked back. I love it. Um, and so from there, I went from the community college, because that was a community college, to the university level. And now this is my fourth university to teach in nursing. And again, I love it. I started off as an assistant clinical professor, and then I've worked my way up to now a clinical associate professor and associate dean. And so it's been very rewarding. And there's nothing like sharing your passion with the next generation. And I can honestly say, I always tell my students, as you know, Maura, I always say, I'm teaching y'all and want y'all to be the best nurses possible because y'all are going to be taking care of me and my grandchildren, right?
Yep.
And
Yep.
that it really rings true. And so I want to prepare the next generation so I'll be able to retire and know that we're going to be in good hands.
That's terrific. I was gonna say, I've had the benefit of being on the side of the desk where I'm receiving your teaching, your instruction, and your passion for it seems very obvious. So it's kind of interesting to hear all that background that brought you here. And that actually really fleshes out how you're able to speak with authority and to pull into lectures. And just when people ask you questions, you're able to speak with a wealth of information about how policies of hospitals help build the future and help change nursing. That's pretty cool. Thanks for sharing that.
Sure.
Um, I mean, and I also think that all of your accolades sort of point to, I mean, they barely hint at all of the hard work that I'm sure has gone on behind the scenes. But I mean, from being a teaching excellent award winner to the Academy of Med Surg Nurses recognizing you for your clinical practice, I think that it's pretty telling that throughout the years you've consistently amassed recognition for all your hard work. And I'm just curious, how would you describe? I know that those awards have particular descriptions that they use to, signal out why someone is excellent in their field. But what are you most proud of in your leadership style, or how would you describe it?
I think my leadership style is one, I hope that it's one of transformation. I hope it's one of trying to lead people and see that, the thing in nursing is the people you work with right now, let's say this semester, those are going to be your peers at the floor. So up until a few years ago, I still worked agency nurses to nurse to keep my bedside skills current, right? And so one of the things is they need to see how the changes, the importance of why we're trying to change things and the buy-in. If we don't show people the rationale for why we're changing, they won't understand the importance. And so I think it's at that very beginning when they're still students, letting them know that we can't just do things the way we always did things because that's not good. We have to have the evidence base, we have to have the research, and we really need to, as healthcare providers, seek out the rationales so that we can constantly be judging what's most appropriate for our patient population. Because if we're just doing everything remotely, we're not really looking at what may be best for that individual holistically or based off of the newest evidence. So I would like to think it's a transformational leadership style where I'm actively listening to the people I'm working with and saying, how do we move the whole bus forward? It's not about individuals becoming the best individual, but it's about how do we move the team forward so the team is the best for the customers and the patients that we serve. And in my situation right now, because I'm more in the academic role, it's really about how do we provide the best, the excellent nurse leaders at the bedside that will grow up and be the nurse leaders beyond the bedside and be on board members, and things like that, actively on boards.
And I know that that is reflected in the published works that you have under your name. I mean, your areas of interest include many different things, but some of the things that have affected me personally are your interest in student success, student test anxiety, interprofessional education, which, you've got such a rich background in that. And so it seems like you have seen gaps in all of those areas as you've gone through the years. And were there any in particular that stood out that prompted you to initiate research or to help finish a research project that you've really seen through the years your impact on the students or the professional settings?
I think one of the areas that I really appreciated working in is with student success. And one of the things that I hope all nursing students realize is it's in nursing, it's such a unique profession. It's not just about people who are book smart. It's people who have great skills in the clinical environment, who really value people. I think one of the things is helping them to learn that they might struggle in one of the areas as far as knowledge, skills, and attitude. But if they're good in the others, we can help them to grow in maybe their weakest area so that they're going to be a well-rounded professional. I started off really looking at test anxiety in nursing students, and I really wanted to maintain those students who are in their first semester because what we find is they can easily get overwhelmed because of the test scores and the need to usually in most nursing programs score at least a 75 at the baccalaureate level. And so I really worked with those students to see test anxiety as where it really is on the continuum. Most people feel like they have some test anxiety, but what we really need to realize is if it's a low or moderate level, that can be motivating to study early, not procrastinate, if we give them the skill sets that they need in order to better prepare and to face their challenge, because we all have different challenges. And so the key is helping them to identify the pluses of it and how they can grow from where they are. But I think that's one of the things that I really like working with nursing students and helping them in that very challenging first semester, because if we lose them that first semester, then again, we're not going to grow our profession and we're going to continue to have the shortages that we have.
That's such a good insight. And you're right, because that's reflected in our national healthcare drive right now. One of the aims of our policy is to have enough healthcare workers to keep them in the healthcare setting and to make sure that there's equitable access to high quality healthcare. And part of that is building up the workforce. And I think that also you have a heart for getting the buy-in from the people. So they're not just in healthcare for a job, they're in it for the people. They're in it to learn and to grow professionally. And that's pretty terrific. Do you think that you're interested in seeing policy changes to help make your goals wider spread or easier to accomplish?
I think so. I think so. We definitely have to look at, our profession compared to the others in healthcare. When we think about it, we see that the other disciplines are moving forward toward, they really want the person who's operating to be at that graduate level preparation. And so, there's a big push for us to get nursing there. Of course, there's a lot of pluses and minuses. A lot of people are saying people who are moving too quickly to the higher levels may not have the stronger foundation that they need. Because again, if you think about nursing, we don't have the years in our preparation like the medical profession does. But yeah, it's building, right? So we have to be able to look at it and say, how do we build upon and scaffold our education so it adequately prepares them for the bedside and for those future career goals that they're going to have. And so we do need to be looking at policy. And I think that's one of the things at the university level that we see because of our regulatory standards that we have through, AACN and looking at the new essentials. We are starting to dig into that more and say what's really evidence-based and what truly are the competencies that will best prepare them. Right now, one of the challenges that we're facing with the newer generation is that they're giving up on nursing quicker than some of us who, came out years ago, right? And
It's hard.
so they get frustrated because they're not adequately prepared or they don't have adequate resources at the bedside. So it's a combination of not only do we need to look at it from a policy and a regulatory standpoint, but we really need to be looking at it at the hospital level as well as at the university level. So it can't just be about the education. It needs to be about where they're going to work when they get out. And I like the fact that now hospitals that are magnet status, they're working with standards as well. But how do we work together better? And I think the new essentials are going to be forcing us to look at it from that team perspective to say, how do we do this better?
I'm hearing you say that those new essentials are really going to be transformative, running with that theme. And that's kind of exciting to think about what that will mean in the next decade and how that will be reflected in our healthcare workforce. Is there any other information that you would like to share with the GNSA, the community at large, regarding your research, your areas of interest, and also to kind of piggyback on that, do you have any advice for the next generation of nursing leaders?
A couple of things, and it's tips. One thing is I would encourage the next generation, don't rush things. Okay, by that I mean one of the things that we see that's hurting the profession is students who are eager to do things faster, cheaper, and that won't necessarily serve you well in your profession. You really do earn your stripes and you really do learn those life lessons if you tend to go a little bit slower and really push yourself at every point. That's the thing I can look back on my career. And again, I was very blessed. Each one of those jobs helped me in a different way that I didn't know how they were going to help me at this point. But it was through those different opportunities I had and not rushing in through each one of them that helped build me so that I hopefully am creating a new workforce that's going to value what they do. Because if you like what you do, then it's not going to feel like work. It's going to be your passion. And that's what's made my work history so exciting. To this day, I knew when I was 6 years old, I wanted to be a nurse. And I've never varied from that. My mom tried to talk me out of it when I was in high school, when I was first going to college. And so when I first signed up for college, I said, oh yeah, I'm pre-dent. The first semester, I changed my major. My mom just didn't see me as a nurse, but I have loved every day of it. I really have.
That's awesome. Nurses are somewhat born, right? That's terrific. Well, thank you so much for your time, Dr. Schrader, and thank you for your insights. Again, I can't say enough positive things as a student who has been a recipient of your knowledge, your expertise, and a lot of your patience. I really appreciate it.
Oh, you're so welcome. Thank you so much. You're going to be great. You are already great.